Robert Sumwalt, and I'm honored to serve as the chairman of the NTSB. And joining us today are my colleagues on the board, the Vice Chairman, Bruce Landsberg, Member Earl Weiner, Member Bella Denzar, and Member Jennifer Homendy. Today we meet in open session as required by the government and the Sunshine Act to consider the fatal collision of a pickup truck with a medium-sized bus near Concan, Texas on March the 29th, 2017. The crash killed 13 people on board the medium-sized bus, including the bus driver. One passenger survived with serious injuries, and the pickup truck driver also survived. On behalf of myself and my colleagues, the entire NTSB, would like to offer our sincerest condolences to the family, the friends, the communities of those who are affected by this tragedy. Today, among other things, we will discuss a witness cell phone video that many of you have probably already seen by now, showing that the truck driver's erratic behavior. He crossed the center line 19 times, and drove onto the right shoulder 35 times in the 15 minutes leading up to the crash. We'll discuss evidence of the driver's impairment, including marijuana and prescription medications found in the pickup truck, with positive toxicology results for THC and impairing medication. The 20-year-old driver's short but troubled pre-crash driving history included at least 8 encounters with police officers in the 4 years leading to the crash. And equally concerning is the evidence found by investigators showing that the driver was immersed in a culture of recreational drug use. But we're not here to punish one driver. We are here to improve safety. The question is, how do we prevent drivers from operating vehicles while impaired? And how to protect road users from drivers who make such choices in the future? Critically, how do we do it before the next crash? End alcohol and other drug impairment in transportation is on the NTSB's list, on the most wanted list for the NTSB. And other drug impairment, well, that's especially on the rise these days. Today's report contains a lot of data on this trend, but the statistics are startling and they stand out. In 2006, drugs were found in 30% of fatally injured drivers, those drivers who had a valid drug test after the crash. And when we talk about drugs, we're talking about, in this case, potentially impairing drugs. Not all are illegal, but the figure in 2006 was 30%. In 2009, that figure had risen to 37%. And by 2015, 46% of fatally injured drivers, those drivers who had a valid drug result after the crash, 46% of those drivers had evidence of potentially impairing medications in their system. We need more and better data to determine what initiatives can most effectively fight the upward trend in drug-impaired driving. But there's no question that the trend is there, and it's certainly moving in the wrong direction. The driver in this crash made terrible choices with tragic consequences. But the rising tide of drug-impaired driving didn't begin with this driver, and unfortunately, it will not end with this driver. So today, we will look at how decision makers at all levels are responding to the drugged driving challenge. And last but not least, we'll discuss the need for lap shoulder belts on medium-sized buses. Bus and seat manufacturers need to move toward installing lap shoulder belts as standard equipment in all seating positions. Today, the NTSB staff will briefly present the most pertinent facts and analysis found in the draft report. The full docket for this accident, for this crash, contains over 100 pages of additional information, including photos, interviews, and inspection records. The way it will go today is staff will present the most pertinent facts. They'll propose findings, propose recommendations, propose a probable cause. We on the board will question the staff to make sure that the report, as we adopt it today, truly provides the best opportunity to enhance safety. Now, Managing Director Dennis Jones, if you'll kindly introduce the staff. Thank you, and good morning.
Thank you, Mr. Chairman. A few announcements before we begin. I kindly request the folks here in the boardroom, if you have not already done so, please silence your mobile phones and other electronic devices. There are 2 exits in front of the auditorium, one to my left and one to my right. Go down the stairs, out the door, and follow the illuminated exit signs to depart the facility. You may also exit to the rear of the auditorium and proceed out the glass doors you entered, go up the stairs, and exit straight ahead through the large glass doors to the outside. In the event of emergency, please walk quickly to the nearest exit and make your way to the outside following the instruction of NTSB staff personnel. Do not delay. Do not return to the boardroom until instructed or advised to do so. If you have any questions or concerns, please don't hesitate to contact any NTSB personnel. Seated at the panel this morning, unless otherwise noted, are staff members of the Office of Highway Safety. On the first row, starting to my right, is Dr. Chris Poland, the Deputy Director. Next is Don Carroll, the Project Manager. Next, David Rayburn, Investigator in Charge. Next, Dr. Nicholas Webster, the Medical Officer. Next, Dr. Raphael Marshall for Human Performance. Next is Ronald Kaminsky for Survival Factors. Directly behind him on the second row is Kenneth Bragg for Human Performance and also the Drug Recognition Expert. Next is Dr. Ivan Chon for Research Analyst and of our Office of Research and Engineering, also known as RE. Next is Dr. Janet Price, National Resource Specialist, Research and Engineering. Next, Jim Ritter, Director of Research and Engineering. Next, Kathleen Silbaugh, General Counsel. Next, Paul Slezak, Director of the Office of Safety Recommendation and Communications. Directly behind him on the third row is Mark Banyard, who will be handling our audio, visual, and timing. Next is Deborah Stocker, the editor. Next, Julie Perot, Safety Recommendation Specialist. Next, Mr. Bob Squire for Crash Reconstruction. Next is Jane Foster for Research Recorder Specialist and for the Office of Research and Engineering. Next is David Pereira for Vehicle Factors. The presentation will begin with a crash overview by the investigator in charge, David Rayburn.
Good morning, Chairman Sumwalt, Vice Chairman Landsberg, and members of the board. Today, staff will present the report of a crash involving a pickup truck and a medium-sized bus, which occurred about 6.5 miles north of Concan, Texas. The crash occurred on Wednesday, March 29, 2017, about 12:20 p.m. local time on U.S. Highway 83, a 2-lane rural roadway. A 2007 Dodge Ram pickup truck, 3500 pickup, driven by a 20-year-old male driver, was traveling north on U.S. Highway 83. At the same time, a 2004 Ford turtle-top Vantera medium-sized bus was traveling in the opposite direction, southbound on U.S. 83. The bus was transporting 13 passengers of the New Braunfels First Baptist Church and was being driven by a 66-year-old male driver. Near the end of a right-hand curve, the truck departed the northbound travel lane and crossed into the southbound lane, colliding with the front left of the bus. Following the impact, both the truck and bus rotated counterclockwise to the area of rest shown in the northbound facing photo. Witnesses following the bus reported no unusual or unsafe driving activity by the bus driver prior to the crash. The speed of the bus was estimated to be about 60 to 62 miles per hour. The speed limit at the crash location was 70 miles per hour. Two people traveling north on U.S. Highway 83 in a vehicle directly behind the truck witnessed it weaving erratically and failing to maintain its lane of travel. The witnesses called the local police department and the sheriff's office to report their concern. They also recorded a 14-minute and 27-second video of the truck's operation. In the video, the truck is observed crossing the white roadway edge line 37 times and crossing the double yellow center line into the opposing lane of travel 19 times. The truck was determined to be outside of its travel lane about 67% of the time. Staff studied the witness video and estimated the speed of the truck was about 69 miles per hour during the last minute of the video recording. Please show the video.
This video shows the operation of a pickup truck by a 20-year-old driver traveling north on US 83 near Concan, Texas, on March 29, 2017. The video shows clips from a cell phone recording made by a witness who was following the truck. Timestamps indicate the elapsed time from the beginning of the recording. Image stabilization software was used to reduce the motion of the camera, and the audio was removed. This clip shows the truck cross the center line into the southbound lane of travel. Here, the truck drifts onto the right shoulder, almost hitting a stopped truck. The truck drives off the right road edge, recovers, and then continues to drive partially on the shoulder. When the road widens to 2 lanes, the truck moves to the right and travels off the paved surface onto the grass. The truck moves partially onto the shoulder and then left across the center line and onto the shoulder on the opposite side of the highway. The truck crosses the center line again as it proceeds around a curve. As the truck reaches a left-hand curve, it moves onto the right shoulder and then left, crossing the center line again as the road transitions to a right-hand curve. Here, the truck crosses the center line as it rounds a right-hand curve with a limited line of sight. At the end of the curve, the truck moves onto the right shoulder. The truck travels on the centerline rumble strips designed to alert drivers and proceeds partially into the opposing lane of travel. The truck travels entirely within the opposing lane of travel on a vertical crest hill with a limited line of sight. This clip shows the final 10 seconds of the witness video. The recording ends about 20 seconds before the multi-fatality crash at the right-hand curve ahead.
Almost immediately following the crash, an emergency services ambulance stopped at the scene to render aid. As you can see in the southbound facing scene photo, the front end of the truck impacted the bus and intruded more than 5 feet into the left side of the bus. The photo on the lower right corner is a view of an undamaged exemplar vehicle, giving you an idea of the severity of the crash. These 2 photos taken at the tow yard show the extent of deformation to the pickup truck. There was extensive intrusion into the driver's compartment. During the post-crash inspection of the truck, investigators found a metal box containing 2 unburned marijuana cigarettes, the remains of 5 partially smoked marijuana cigarettes, and a package of rolling papers. Additionally, the bottles of prescription medication were found in the front cab of the truck. The truck driver told a Texas Department of Public Safety trooper that he had taken 2 pills of a medication, clonazepam, about an hour earlier. He said the medication was for post-traumatic stress disorder and the medication made him drowsy. As a result of this crash, the bus driver and 12 passengers were fatally injured. The driver of the truck and one bus passenger sustained serious injuries. I'd like to acknowledge the on-scene staff. And this slide shows the report development staff. This slide shows the parties to the investigation. Before we move on to staff presentations, I'd like to discuss those items determined to be non-contributing factors and the key safety issues in the investigation. Staff determined that both drivers were properly licensed and familiar with their vehicles and U.S. Highway 83. The highway and weather conditions did not play a role. There was no evidence of any mechanical problems with the bus or truck contributing to the crash. Bus driver medical condition, fatigue, impairment by alcohol or other drugs, or distraction by the use of a cell phone did not contribute to the crash. Immediately following the crash, the truck driver told witnesses that he had been texting at the time of the crash. The truck driver told witnesses that he had been texting at the time of the crash. A forensic examination of the truck driver's phone showed no evidence he was texting or making a phone call at the time of the crash. Even if the driver was glancing at his phone or manipulating his phone, it does not explain the prolonged and continuous erratic driving seen in the video. The investigation identified two primary safety issues: drug-impaired driving and the adequacy of seatbelt systems on medium-sized buses. Dr. Marshall will be discussing measures to improve the detection of drug-impaired driving through training and the development of roadside drug testing devices. Mr. Carroll will discuss efforts at the state and national levels to prevent drug-impaired driving crashes, drug testing protocols, and the need to identify effective science-based safety countermeasures. Mr. Kaminsky will address the need for lap shoulder belt systems as a means of providing a greater level of protection for medium-sized bus occupants. Dr. Webster will now give the presentation and will provide an overview of the truck driver's medical conditions, the toxicology results, and the impairing effects of illicit and prescription drugs on the body.
David, thank you. Good morning. This morning, I will be discussing the truck driver's medical conditions, prescribed medications, and his use of the impairing drug marijuana and the impairing prescription medication clonazepam. The truck driver, a 20-year-old male, was in good physical health. However, he was voluntarily hospitalized for evaluation of anxiety and depression between September 27 and October 5, 2016, and was discharged with a diagnosis of depression and post-traumatic stress disorder, or PTSD. Depression is a chronic debilitating disease characterized by depressed mood, loss of interest or pleasure, and impaired thinking, concentration, and decision-making. His other diagnosed condition was PTSD. Individuals suffering from PTSD may relive the traumatic event, experience excess arousal to stimulus, and avoid situations that cause symptoms. At an outpatient visit on November 14, 2016, a psychiatrist documented that the driver was doing well on his prescribed medications, was not a danger to himself or others, had no other medical or psychiatric conditions, and reported no substance abuse. The plan was to follow up as needed. There was no record of the truck driver seeking any additional follow-up treatment with the psychiatrist between November 2016 and the date of the crash. The driver had been prescribed 4 medications. Clonazepam is a sedating impairing benzodiazepine prescribed to treat anxiety symptoms associated with PTSD. Additionally, he had been prescribed zolpidem, also known as Ambien, a short-acting, potentially impairing sleep medication. Post-accident blood testing detected clonazepam, but there was no post-accident evidence that the truck driver had recently used zolpidem. Finally, he was prescribed escitalopram for depression and prazosin for PTSD symptoms. Both are generally not considered impairing. Blood was collected about 2 hours after the crash. Toxicology testing was initially conducted by the Texas Department of Public Safety Crime Lab, and later the FAA's Bioaeronautical Science Research Laboratory performed targeted testing on a limited leftover sample. This table presents the 2 impairing compounds detected. Testing did not detect alcohol. The first potentially impairing drug, tetrahydrocannabinol, or THC, is the primary active chemical in marijuana. Concentration of the parent drug, THC, are very dependent on the type and frequency of use, as well as the dose. Although the half-life of THC varies significantly based on the frequency of use and body physique, controlled studies demonstrate that detectable THC levels decrease by about 90.3% from their maximum level within 1.4 hours of last use. Therefore, it is likely that the driver's THC level at the time of the crash was higher than the 7.1 nanograms per ml detected in his blood 2 hours after the crash. However, NTSB investigators could not determine when he last smoked marijuana, the exact level of THC in his blood cannot be reliably back calculated. Marijuana can affect the cognitive and motor skills critical to driving, such as vigilance, drowsiness, time and distance perception, reaction time, lane tracking, and coordination. Simulator studies of the effect of marijuana on driving have found that some drivers with an average THC level of 13 nanograms per mil demonstrated lane weaving similar to that of a driver impaired with a blood alcohol at a concentration of 0.08 grams per deciliter, which is considered impairing and is the legal limit for blood alcohol in most states. The second potentially impairing drug detected was clonazepam, a potent sedating benzodiazepine that had been prescribed to the driver for treatment of his PTSD. He was actually prescribed 1 milligram 3 times a day. There is evidence the truck driver routinely misused prescription medications by not taking it as prescribed and not taking the correct dosage. The truck driver reported taking 2 1 milligram tablets an hour before the crash, double his prescribed amount. The driver's blood level collected 2 hours after the crash was 50 micrograms per ml. This is about the same average blood level of clonazepam identified in a study of 164 people arrested for drug-impaired driving. THC, marijuana's primary active psychoactive chemical, and clonazepam are both potent CNS depressants. Each drug in combination is likely to enhance the impairing effect of the other. In summary, there was no evidence the truck driver was impaired by his medical conditions. The video demonstrates evidence of prolonged, erratic driving not explained by cell phone distraction. Therefore, staff determined the pickup driver failed to control his vehicle due to impairment by the use of marijuana in combination with misuse of a prescribed medication, clonazepam. Human performance investigator Dr. Raphael Marshall will next discuss measures to improve the detection of drug-impaired drivers.
Good morning. This presentation describes the truck driver's background, followed by proposed solutions to better detect impaired drivers through additional training and tools such as roadside drug screening devices. At the time of the crash, the driver was 20 years old and held a Class C non-commercial driver's license. Evidence gathered during the investigation indicated that the truck driver was misusing his prescription medications and was engaged in the purchase, sale, and trading of drugs for recreational use. In the 4 years prior to the crash, the driver had interactions with law enforcement at least 8 times, including one occasion in 2015 when the driver crossed the center line and collided with another vehicle. The officer investigating that crash did not have advanced training in the recognition of drug-impaired drivers. Studies have shown that many officers are not sufficiently trained to identify the signs and symptoms of driver impairment when illicit, prescription, or over-the-counter drugs are involved. Advanced drug recognition training among law enforcement officers increases the likelihood that impaired drivers are correctly identified and taken off the roadway before they cause harm. Furthermore, if enough law enforcement officers are trained in these techniques, it serves as a deterrent for those who would otherwise risk driving while impaired. There are 3 levels of drug recognition training. The standard field sobriety test protocol trains officers to identify and assess drivers suspected of being under the influence of alcohol. All officers in Texas receive this training at the academy. The Advanced Roadside Impaired Driving Enforcement Training trains officers to observe, identify, and articulate the signs of impairment related to alcohol and other drugs. About 10% of officers nationwide have completed this training, compared to less than 5% of officers in Texas. Finally, officers who complete the rigorous drug evaluation and classification program become experts in identifying the signs and symptoms of impairment by various categories of drugs. About 1.2% of officers nationwide are trained drug recognition experts. Texas has about half of the national average of drug recognition experts. In 2015, the state of Texas evaluated its impaired driving program and found that the number and distribution of drug recognition experts failed to provide adequate statewide coverage. Therefore, staff proposes that the Texas Department of Transportation promote the importance of attending drug-impaired driving enforcement training and increase training access to meet the demands of local and state law enforcement. Roadside drug screening tools can further assist officers in obtaining a preliminary indication of drug impairment. One such class of tools are oral fluid testing devices. Oral fluid testing devices have been found to accurately and reliably detect the presence of certain classes of drugs in a driver's system. While current devices cannot quantify the concentration of drugs identified, they can be used to support a request for a timely evidentiary blood test. A rapid screening test, followed by a timely blood test, reduces the chance that an intoxicating drug will be lost in the body's metabolism. Oral fluid screening devices are relatively new and are not yet in widespread use. Staff believes that NHTSA can further promote its use by publishing guidance to the states as well as information regarding devices that meet minimum criteria for reliability and effectiveness. Staff is proposing a recommendation to be issued to NHTSA to develop and disseminate best practices, identify model specifications, and create a conforming product list for oral fluid drug screening devices. In summary, staff believes that to better detect drivers operating under the influence of drugs and deter others from driving while impaired, law enforcement officers need advanced training to identify the signs and symptoms of impairment. In addition, the widespread use of oral fluid screening devices can improve the ability of law enforcement officers to detect drug-impaired drivers. This concludes my presentation. Mr. Carroll will now give his presentation on drug-impaired driving countermeasures.
Good morning. As you've heard from Dr. Webster and Dr. Marshall, combating drug-impaired driving is a very complex problem. My presentation will discuss the efforts of the state of Texas to combat drug-impaired driving. This will be followed by an overview of the national problem and the need for additional leadership in identifying best practices and countermeasures. Finally, I will discuss the need for a standard practice of drug toxicology testing. Texas impaired driving law addresses all substances. Driving while intoxicated includes any person not having normal use of mental or physical faculties as a result of consuming alcohol, a controlled substance, an illegal drug, or any other substance into the body. Texas highway safety plans address alcohol and other drug countermeasures together. A review of data shows that Texas has the highest number of fatalities involving an impaired driver and ranks 5th in the nation in the rate of impaired driving fatalities per vehicle miles traveled. Additionally, the number and rate of fatalities involving impaired drivers has been increasing. Each year, Texas Department of Transportation submits a highway safety plan outlining strategic highway safety goals and emphasis areas for the coming year. In the state's Strategic Highway Safety Plan for 2017 through 2022, the plan acknowledges that Texas is facing a crisis in road safety. Impaired driving is listed as one of the top emphasis areas in the plan, with over 38% of the total state fatalities involving an alcohol-impaired driver. Nationwide, the average among other states is 28%. While less is known about the number of drug-impaired driving-related deaths, in those crashes where a valid test result was taken, 47% tested positive for at least one drug. It should be noted here that the presence of a drug does not necessarily mean that the driver was impaired. There's not yet a clear link between the drug concentrations found and measured and whether a driver is impaired. Within the Texas Strategic Highway Safety Plan, the vision statement reads, Texas envisions a future with 0 traffic fatalities and serious injuries. Although Texas vision is 0 deaths, the planners have set performance targets for what they consider are realistic targets rather than their aspirational goals. The targets were set by Texas with the expectation that the economy and the population will continue to grow. Texas expects the rate of impaired driving fatalities will continue to increase, and the number of impaired driving fatalities will exceed 1,600 by the year 2022. The state of Texas has developed countermeasures to address the impaired driving problem. The state also convenes an impaired driving task force that meets twice a year and has developed a statewide impaired driving plan. In 2015, Texas requested the National Highway Traffic Safety Administration's assistance in assessing the state's impaired driving program. The assessment was completed by a panel of highway safety experts who identified shortcomings in leadership, resources, training, and in other areas. The assessment team issued over 65 recommendations to address deficiencies in the impaired driving program. 25 of these recommendations are not currently being addressed or require legislative action. One recommendation made in the assessment called for additional engagement by the governor's office and state legislature. Leadership from the top and a commitment to safety are needed to reverse the statewide trend of increasing deaths and injuries due to impaired drivers. Staff is proposing a recommendation be issued to the state of Texas to complete an executive-level review of their impaired driving program and implement strategies that result in a downward trend in fatalities, injuries, and crashes involving impaired drivers. Nationwide, the use of both legal and illicit drugs is increasing among drivers. In reviewing data of fatally injured drivers, the percentage of fatally injured drivers with a positive drug test has increased from 30% in 2006 to 46% in 2015. In 2013 through 2014, NTSB conducted a roadside survey of drivers during weekday nights and weekend nights. In each time period, over 22% of the drivers tested positive for some potentially impairing drug or medication. Marijuana was the most prevalent drug, with 12.6% of drivers testing positive on weekend nights. The study showed that the prevalence of drugs has increased significantly from a similar roadside survey that was conducted in 2007. At the beginning of 2018, the National Highway Traffic Safety Administration introduced an initiative to combat drug-impaired driving. Responded to the national opioid epidemic and the decriminalization of marijuana in the states, NTSB announced a top priority of the agency was combating impaired driving. NTSB held a summit that brought together key stakeholders for a national dialogue in August of this year. NTSB kicked off a public affairs safety campaign. If you feel different, you drive different. Drive high, get a DUI. Many highway safety groups have begun to develop guidance regarding how to address the drug-impaired driving problem. While there is extensive information on science-based countermeasures to reduce alcohol-impaired driving, relatively few countermeasures have been identified focused on drug-impaired driving. Staff is therefore proposing that a recommendation be issued to NTSB to have them evaluate best practices and countermeasures found to be most effective addressing the drug-impaired driving problem, and then issue guidance to the states. Post-crash drug toxicology testing is inconsistent among the states. There is currently no national guidance on a minimum set of drugs that should be tested for, recommended methods for drug testing, or reporting thresholds on crash databases. Collecting consistent post-crash data will provide policymakers with better understanding of the prevalence of drug use among drivers, as well as tools with which to assess the risks associated with these substances. Staff is therefore proposing that the board reiterate a safety recommendation H12-33 to NTSB to develop a recommended standard for drug toxicology testing. In summary, action is needed in Texas to reverse the upward trend in fatalities and injuries among impaired drivers. Nationwide, the use of both legal and illicit drugs is increasing among drivers. National leadership is needed in identifying effective science-based countermeasures. Finally, a common standard of practice for drug toxicology testing is needed to better understand the effectiveness of laws, enforcement, and educational efforts. This concludes my presentation. Now Mr. Kaminsky will address and discuss medium-sized bus seatbelt systems.
Good morning. In this presentation, I'll begin with an overview of the injuries sustained by the medium-sized bus occupants and their seatbelt usage. Next, I'll discuss the effectiveness of lap belts and their design. And I'll conclude with a discussion of lap shoulder belts and the need to make lap shoulder belts standard equipment on medium-sized buses. The crash was a severe offset head-on collision, resulting in fatal injuries to the bus driver and 12 bus passengers, shown in red in the diagram. A 64-year-old woman seated in the right rear corner of the bus survived with serious injuries. The bus was equipped with lap shoulder belts at the driver and front passenger seats and had only lap belts at all other seating positions. All the occupants were restrained. As shown by the shaded area, there was over 5 feet of intrusion into the driver's seating area and into the second row of passenger seats. Occupants seated within this intrusion zone sustained severe blunt force trauma injuries. Behind the intrusion zone, there was survivable space. The passenger seats outside of the intrusion zone remained intact, undamaged, and attached to the floor. Majority of the occupants seated in the back 2 rows of the bus sustained multiple injuries to their neck, head, abdomen, and pelvis. These passengers had evidence of injuries from upper body flailing. Surviving a severe offset head-on crash is dependent on maintaining space around the occupant and controlling the motion of the occupant's body so that a person can ride down the crash forces as the vehicle decelerates and avoid injury-causing contact with the structure or other occupants. In this crash, survival space was available in the rear half of the bus. Although the seating positions were equipped with lap belts to maintain the occupants in a seating compartment, the lap belts restrained only the pelvis area and did not limit upper body flailing. The figure shown depicts the movements of a lap-belted occupant during a frontal collision. This motion is also referred to as jackknifing over the belt. The NTSB has a lengthy history of studying occupant protection and seat belts in both passenger cars and buses. Studies have shown that lap belts do not control upper body flailing and can sometimes result in injuries. The study found that occupants wearing lap belts would have fared substantially better if they had been wearing lap and shoulder belts. During a post-crash inspection of the bus, we identified issues with the installed lap belts. In the back row of seats of the bus, the anchorage points for the belts were extremely narrow. As shown in the 2 photos, the anchorage points were only 6.5 inches apart laterally. In this crash, the occupants were rapidly decelerated and jackknifed forward over the lap belt. The narrow anchorage points caused a pinching and scissoring action of the belt webbing on the abdomen and pelvis, resulting in extensive injuries. Although the Federal Motor Vehicle Safety Standard 210 allows seatbelt anchorages to be placed as close as 6.5 inches apart, staff does not believe this is adequate for most occupants. Staff is proposing that NHTSA amend FMVSS 210 to increase the minimum anchorage spacing for individual seatbelt assemblies, taking into account the testing of seatbelt design, seatbelt fit, and vehicle configuration. NHTSA's 2016 rulemaking considers medium-sized buses as a separate vehicle class. They're excluded from regulations requiring that all motor coaches and large buses over 26,000 pounds gross vehicle weight rating be equipped with lap shoulder belts in all seating positions. Since most medium-sized buses are between 10,000 pounds and 26,000 pounds gross vehicle weight rating, there is no requirement for bus passenger seat belts. When NHTSA developed regulations, their research determined that lap shoulder belts provide a greater restraint for the upper body and distribute the load over a larger surface area. The figure shown depicts the difference between a lap belt and a lap shoulder belt system when a vehicle is involved in a frontal crash. Lap belt loads are concentrated to the hips and abdomen alone, allowing for upper body flailing. NTSB has urged NHTSA to include medium-sized buses in their rulemaking based upon our experience investigating other catastrophic and medium-sized bus crashes. Following a 7-fatality medium-sized bus rollover crash in Dolan Springs, Arizona, in 2010, the NTSB recommended that NHTSA include in their rulemaking all buses over 10,000 pounds. Safety recommendation H10-3 was issued so that the medium-sized buses were not excluded from vital occupant protection standards. Occupants on medium-sized buses deserve the same level of protection as passengers on motor coaches. large buses, and smaller passenger vehicles. As a result, staff is proposing that we reiterate safety recommendation H10-3 to NHTSA. Most medium-sized bus manufacturers offer passenger lap and shoulder belts as an option. Industry representatives have informed NTSB that demand for lap shoulder belts is increasing. According to data provided by the Medium-Sized Bus Manufacturers Association, in 2015, the production of medium-sized buses in North America has grown to the point of outselling full-size motor coaches by more than a 5-to-1 ratio. Since timely regulations requiring lap and shoulder belts is unlikely anytime soon, safety-focused action is needed by medium-sized bus manufacturers and seat manufacturers. Staff is proposing a recommendation calling on medium-sized bus manufacturers and bus seat manufacturers to install lap and shoulder belts at all seating positions as standard rather than optional equipment in all newly manufactured buses. In summary, staff found that injuries of passengers seated in the rear of the bus were exacerbated by upper body flailing over the lap belts, which concentrated the load on the pelvis and abdomen. The narrow anchorage points on the rear row of seats increase the severity of injuries. Regardless of belt type, the anchorage spacing needs to be increased. Lap belts provide a greater level protection, and bus and seat manufacturers should move toward providing them as standard equipment for all seating positions on medium-sized buses. This concludes my presentation. Dr. Poland will now provide some remarks regarding this investigation.
As you've seen, this was a catastrophic crash in Concan, Texas. Staff have proposed strong recommendations to address the pickup truck drivers' drug-impaired driving and to strengthen occupant protection for medium-sized buses. We are proud of this report and look forward to your questions and the discussion. Thank you.
Well, thank you, Dr. Poland, and to the staff. We are proud of your report also, so thank you very much. We'll now go to the board member questions, beginning with the Vice Chairman, Bruce Landsberg.
Thank you, Chairman Simwalt. Dr. Webster, when a physician prescribes medication to a patient, is the patient advised about the potential dangers and impairment possibilities of legal prescriptions? And if they have a sense, this may be fishing a little bit, but do they have a sense if someone is inclined to use recreational substances that the interaction of the two may be exceptionally catastrophic?
Generally, a physician is going to discuss any medication that is given to a patient and the side effects. As far as the interactions between prescription medicines and illicit drugs, in my experience, physicians have not been doing that, possibly because there's not a lot of research in that area.
Okay, thank you. Mr. Carroll, have we made any recommendations, or has NHTSA, relative to the fact that we really seem to have an epidemic here of increasing impairment problems? And we also hear in the news that more states are looking to allow recreational drugs into the system. I understand why. There's revenue to be made and so forth, and there's a constituency that likes that. The problem is that the interface between driving and using these substances can be problematic. What kind of communication has NHTSA had, or any government agency, with these various states that are considering this?
Yes, thank you, Vice Chairman, for the question. NHTSA, as seen from my presentation, has really started to take a strong stance on drug-impaired driving. But right now, it's still more or less in the infancy stages, in that they're basically meeting with stakeholders, holding listening sessions, and so forth. What staff is proposing is that NHTSA basically evaluate all the countermeasures that are being implemented right now and figure out what is the most effective means of addressing this problem, and then basically providing guidance to the state from a national leadership standpoint.
Do we have any data in the states that have approved recreational substances? Have they seen an increase in drug-impaired driving?
The answer to that is difficult regarding the drug impaired because of the reasons that we said before. There has, however, been shown in Colorado and Washington that there is a greatly increased prevalence of drugs found in fatally injured drivers in those states. Determining whether that was due to the impairment from the drugs is less known on that.
Thank you. Mr. Kaminsky, I'm a little confused here on the H10-3, which is our previous recommendation, I believe, to NHTSA to require lap shoulder belts as standard on vehicles between 10,000 and 26,000 pounds. Have we made such a requirement to them that you know of?
Well, we made the H10-3 when we made that recommendation. That was after the Dolan crash, and we wanted them to be included because what they were they ended up going for everything over 26,000 pounds. So we have this gap of between 10,000 and 26,000 pounds where these vehicles aren't required to have any lap belts other than for the driver and front right passenger.
So have we made a recommendation to NHTSA to fill this gap?
Yes, we have. Yes, and that's why we're reiterating this recommendation again.
I understand. Thank you.
Great, and just to clarify, that's what 10-3 is. It's the recommendation for, among other things, I think roof strength, window glazing, and restraint systems. Is that correct?
That's correct, sir.
Okay, because the Vice Chairman and I were talking about that ahead of time, and so I just wanted to clarify that in my own mind. So thank you very much. And Member Weiner.
Thank you. The chairman in his opening remarks brought up the most wanted list. Excuse me. One of the items on the most wanted list is the encourage implementation of anti-collision systems. Now, the bus in this case was about 14 years old. Are there any technologies that might have made a difference in this particular case? I guess that's a question for Mr. Rayburn or Mr. Carroll.
Are you generally referring to areas about occupant restraint or more toward collision warning type systems?
Well, both are on the most wanted list, so
Yeah.
both would be fair game.
In this particular case, the greatest improvement could have been in the occupant restraint area. There was not much time to avoid the accident with both vehicles approaching highway speed around a curve where there was only like 600 feet of sight distance. So even technology-based anti-collision systems probably would not have helped much in this case.
Would V2V, vehicle-to-vehicle communication, have been useful here?
Yeah, those are good questions, Dr. Weiner. So staff considered a forward collision avoidance systems or possibly a vehicle-to-vehicle communication system as a collision avoidance in this crash scenario. But of course, as you saw from the video, the driver was driving erratically, so at some times he was in his lane of travel. So we felt like this was an especially challenging circumstance going around a curve with a vehicle that at times was in his lane of travel for a vehicle-to-vehicle communication system, or especially a forward collision warning system where there wasn't visibility forward on this curve to be able to address that. And that's, of course, why staff is trying to avoid this circumstance through our drug-impaired driving recommendations, and then also to mitigate the consequences through those lap shoulder belt recommendations.
So occupant protection is the most likely effective mitigation, is that correct?
To be honest, I would rather see that we had some of the impact of the drug impaired recommendations be effective so that we didn't have an impaired driver on the road in the first place.
What about roadway design? Would that have made any difference? There were rumble strips on both the center and the shoulders.
Yeah, along this area, remember now, the video recording was for 14 minutes and 27 seconds. Large sections of the highway that the driver was on did have centerline rumble strips and roadway edge lines. At the exact spot where the collision happened, there was not roadway edge lines and there were no centerline rumble strips because that particular area had not been identified as a problem. It had a very low accident rate, so there were no centerline rumble strips or edge line rumble strips. However, after this accident, the Texas Department of Transportation in some later projects added centerline rumble strips and edge line rumble strips.
So what are the criteria that the Texas uses to determine whether rumble strips are necessary or not?
Well, they generally look at a 5-year average of accidents, and they look at the type of accidents that could be prevented by a particular countermeasure. In this case, there were only about 30 accidents over a 6-mile-long area in a 5-year period, so it's a pretty low accident rate. And most of those accidents were rear-end type collisions, and there was only one fatal accident in that 6-year period preceding this accident, and it was a run-off-the-road type crash. So the criteria is it's mainly based on accidents over a 5-year period, and the accident rate was very low at this location.
Now, from the video, it was clear that the rumble strips didn't seem to be very effective in getting this driver to either get back in his lane or get off the shoulder. Is that because of the drug impairment largely? And are rumble strips ordinarily more effective than what we saw in the video?
Ordinarily, the purpose of the rumble strips is to alert a temporarily distracted driver or a driver that's perhaps a little drowsy, somebody that's grossly under the influence of drugs. It's obviously didn't have much of an effect.
Thank you, Mr. Rayburn.
Thank you, Member Weiner and Member Densar.
Thank you, Chairman, and thank you to the staff. Every investigation we do is so important, and I know that we take such care with all of them, but I suppose this one was especially close to home to me because I'm Texan, and I've certainly driven around New Braunfels and the area, that part of Uvalde County. So I especially appreciated that the report looks at long-term, perhaps not so easy, but lasting prevention solutions. And also that you acknowledge that the professionals and advocates, the Texans, have already done a lot to try to work on this solution, such as the Texas Strategic Highway Safety Plan. So I have a question about one of our recommendations. One of our proposed recommendations calls for an executive-level review of Texas's impaired driving program. Could you explain how this review differs from the assessment that Texas already did, the state impaired driving assessment that was done in 2015?
Yes, thank you, Member Densar, for the question. And I share your concern that I'm not a Texan, although I do have 3 adult children that drive in Texas and a grandson and so forth that all live in Texas. So I share with you in that concern that we are interested in improving safety. This recommendation we're hoping be issued to the executive level, meaning the governor, the legislature, the attorney general. At the top level, safety starts at the top. During the assessment that was done by NHTSA in 2015, One of their recommendations was for an executive steering committee with basically legislative representatives and so forth to participate in the task force meetings that meet twice a year to discuss legislative agenda and so forth. That recommendation that was issued by NTSB in 2015 has not been acted on. So we believe that a recommendation to the top level will hopefully shine a spotlight on the impaired driving problem that exists in Texas.
So this is a more, a higher level review in addition to what the SHSP, or the impaired driving assessment that has already been done. But this would be at a higher level to draw more attention to that. Is that correct?
Yes, that's correct. And also, as stated in the proposed report, we're hoping that obviously as part of the executive level review, they'll use that prior assessment as a resource. There were 65 recommendations issued in that, and they can review some of those recommendations to see, hey, how can we move forward more on these recommendations?
Thank you, Mr. Carroll. And as you mentioned in your remarks, there is an anticipated increase in the rate of fatalities and serious injuries. Does TxDOT offer any explanation of why it anticipates this increase? And does it offer any suggestions related to that?
Texas planners, and it involves a lot of stakeholders across the state from all different levels, are involved in developing the strategic highway safety plan. And as part of that plan, they're required to set performance targets as to what they believe they're going to be over a long term, in this case, up through 2022. The Federal Highway Administration does not set strict requirements on how those targets are set. So different states set their targets different ways. A lot of states will say, hey, this is our baseline for the last 5 years, and we're going to reduce from that baseline of what we are now, reduce that by 2%. Texas, in their plans and through my discussions, basically says we have a growing economy, a growing population, so we believe that our number of fatalities, our number of injuries, and our rate is going to continue to increase. And we're going to take that increase and we're going to try to reduce that increase by 2%. So they're trying to basically reduce the trend rather than reduce the numbers. And they're trying to do that because they're trying to set realistic and what they believe are attainable goals.
Thank you, Mr. Carroll. That's really helpful. As the report says, Texas is facing a crisis in road safety, which is what I know you quoted from their strategic highway safety plan. So I think this terrible crash is one example, and I think that our work will help keep your family and mine safe. So thank you. Thank you, Chairman.
Member Denzar, thank you very much, and Member Homendy.
Thank you, and I actually want to follow up on what Mr. Carroll said in response to Member Denzar with respect to the Texas's strategic highway safety plan. I think it is not strategic at all, some of their assumptions, and I read the plan. It states, quote, impaired driving was identified as a factor for 39% of all fatal crashes in the state. The crashes resulted in more than 9,000 fatalities and 19,000 injuries, and the plan goes on to state that their vision is 0 deaths. The plan states the vision of 0 deaths on our roadways is founded on the belief that everyone, no matter how they travel, should be able to arrive at their destination safely. I agree. But the chart on page 56, and you also showed us a slide, shows that in 2015, impaired driving fatalities there were 1,323 impaired driving fatalities. The state projects 1,653 and then comes up with a target for 2022 of 1,000, 620, because, as you stated, they want to be realistic. My question is, how do you get to 0 if you're focused on 2% of the higher number and not 2% on the lower number? You should be focused on reducing the 1323, not the 1653. Am I wrong?
Staff, I believe, agrees with that, and that's the reason that we're basically making the recommendation that, you know, the state needs to really look at what they're doing to see how they can reverse that trend.
Right, and I know some would say, well, population is increasing, there will be more accidents, but I think you also have to, as you said earlier, you have to focus on the rate. And you have here that their rate for alcohol-related driving fatalities for 2015 was 0.51. Their projection for 2022 is 0.58, but then their target is 0.57. Again, the reduction should be off the lower number. That should be the goal. You're not going to get to 0 if you're just focused on reducing the higher number. I want to circle back to Dr. Webster, and thank you for that. So an hour before the crash, the truck driver took 2, and it's difficult to say clonazepam, so I'm going to use the brand name of Klonopin, which is what it is. Took double of that, and Klonopin comes with a warning, quote, it could interfere with your judgment, thinking, and reaction time, and that you should not drive with it or use machinery or do other activities that require alertness. The doctor did provide that information and those warnings to the patient, correct?
That's what the note says,
That's
yes.
it, yep, okay. But in addition to the double dose of Klonopin, you have the marijuana use.
Yes, you do.
And I was looking at the Substance Abuse and Mental Health Services Administration does a national drug survey, and it showed that a decade ago, 20.2 million adults aged 18 and over were current users of marijuana. That increased to 26.3 million over a period of 10 years. So we're seeing more drug driving cases, both in personal and commercial vehicles, and then, but the problem here is that it's difficult to determine impairment. We have decades of research on alcohol, not as much on the marijuana side, and I'd like to see if you could have some time to explain to people. I have a background in this, but if you can explain to those that are watching why it's so difficult, what recommendations we've issued, and how those have responded.
Well, I'm going to address the problem with the alcohol versus the marijuana. Alcohol is well studied. We know how it's metabolized. Alcohol, when you drink, goes straight into your bloodstream and distributes evenly throughout your body in all the water-based tissues. It is then metabolized at a steady rate. It goes down steadily. We can calculate 2 hours later, if we got a blood test on you, we can reliably calculate what it was at the time of the accident. However, marijuana, or the THC part of marijuana, the active psychoactive chemical, is a fat-soluble drug that is absorbed fairly quickly into the tissues, the fatty tissues, and one of those tissues is the brain. And a correlation between what's in the blood and what's in the brain is very difficult to do because of that. So we are unable to get a precise determination of impairment based solely on a blood level. And again, we still cannot back calculate 2 hours later. This gentleman was a 7.1. We cannot tell you what his level was at the time of the crash.
Thank you. I apologize for going over on time.
Thank you very much, Member Homendy, and great discussion there, Dr. Webster. Thank you. So I'm going to read some numbers. They might sound like lottery numbers, but they're not. 37, 19, and 13. 37 is the number of times that the truck driver crossed onto the right shoulder of the highway. 19, the number of times he crossed the road center line. And 13, the number of fatalities in this needless crash. So I said they're not lottery numbers, but when you use impairing medications, including alcohol, you do gamble. You gamble with lives. And that's exactly what happened here. And there's a lot more that needs to be done, and I think our recommendations go towards working on that problem. So thank you all for these recommendations. Dr. Webster, while we're talking about drug use, benzodiazepam, you mentioned that the driver took 2 tablets, 2 dosage of that within about an hour of the crash. Is that pretty close?
According to the driver's statement.
Okay.
Yes, sir.
Okay. Do you recall how much risk that sort of a dosage could increase a crash risk?
I can't quantify that crash risk. The amount of drug and the response varies from individual to individual. My concern in this case is this is an individual who is not routinely, apparently not routinely using his drug or medication as designed. We have texts that demonstrate that he is using it for recreational purposes and to get high. So the risk, I can't say what it is, but what I can say is in people who have been involved in driving under the influence crashes, with the drug clonazepam, his blood level was the same as the average of all of those people, the 164 people in that study. And so his risk is similar to those people who were charged with a DUID in the past.
Thank you. And I was reading on page 44 of the report that according to a meta-analysis reporting the crash risk of 1.6 to 1.8 times of that for benzodiazepine and such as clonazepam. So there's definitely an increased crash risk. And I think what you just said is important, that I think you said that that sort of a dosage would be equivalent to a blood alcohol concentration of 0.08?
No, that's something different, sir. I'm not going to correlate
Okay.
his drug level to a blood level of alcohol, but I will say that it's a level that was consistent with impairment found in other drivers who had used clonazepam and who were arrested for using clonazepam.
Thank you very much. By the way, you mentioned some text. The driver was using drugs to get high as opposed to a clinical purpose. Did the text indicate any other activity that he might have been involved in?
Yes, Mr. Chairman, the text also showed that he was selling his prescription drugs.
Okay, thank you. He was selling his prescription drugs. You know, when I read the figures about the increases that I cited in my opening statement, increase in fatally injured drivers with valid drug tests and drug results after the crash, and I mean it's alarming that the numbers have gone up that much. Now, we mentioned that not all of those drugs are illegal. That could be any potentially impairing drug. Is that correct, Dr. Webster?
Mr. Chairman, would you repeat the question, please?
Well, when we mentioned, in fact, it was on slide 33, we talked about the increase in fatally injured drivers with valid drug results. That number has increased in 2006 from 30% of fatally injured drivers to 46% of fatally injured drivers with valid positive drug results after the crash. That's not just, that's not all illicit drugs, is it?
I'm going to let Dr. Chung answer this question because he is very knowledgeable about the data and he was the one who compiled that.
Chairman, you're correct, and this is basically NHTSA attempt to consolidate and compile fairly inconsistent way of documenting drug involvement in fatal crashes. This includes both potentially impairing or it could be just any forms or any types of drug in the fatally injured driver.
Okay, thanks. And I'm out of time, but I do want to just clarify that. And so just because a drug is potentially impairing does not necessarily mean there was impairment. Is that correct? Yeah, couldn't hear, but I think your response was that is correct. And it is alarming, though, that there's an increase. So thank you. And we'll go to the second round, going to Vice Chairman Landsberg.
Thank you, Mr. Chairman. I noticed there was a statement in the report here. NHTSA has a really catchy slogan. It says, "Get high, get a DUI." And yet I read in another part that the odds of somebody actually getting stopped are exceedingly low, which makes that kind of a hollow threat. I may insult your great state here just a little bit, Member Denzar, but I see here in the Texas Highway Safety Plan, they have 65 different areas, some of which are addressed, some of which aren't, and so forth. And that seems like a pretty ambitious piece of paper, but it doesn't look like they're having much in the way of results. How much money, do we have any idea how much money they're really putting forward to this? Is this kind of an idle threat, or are they serious?
Without getting into explicit details regarding the various grant programs, the federal grant programs from both the Federal Highway Administration and the National Highway Traffic Safety Administration, there's two different grant programs. The National Highway Traffic Safety Administration has grant programs that go specifically to the alcohol and drug countermeasure program. And that could be spent on both alcohol and drugs. And believe the last couple fiscal years, it's reigned about $15 million devoted specifically to the alcohol and drug countermeasure program. That's for the state of Texas, and I don't know if that sounds like a lot to you, but when you're talking about 15.8 million licensed drivers in the state, it may not be that much. Now, with that, it's broken down. The plan has, for example, in last fiscal year, they spent $866,000 on the training programs, drug recognition and A-RIDE training programs, and it's broken down into various amounts. The state is required to submit to NHTSA what they plan on spending their federal funds on.
It doesn't sound like a lot of money to me, frankly. And if this is the crisis that I think we all agree and see here, I don't know that it's within our purview to make recommendations in that regard, but it's really hard to accomplish something like this without having the proper funding to do so. No further questions, Mr. Chairman.
Thank you, Vice Chairman. Member Weiner.
The driver in this case was 20 years old and under the influence of both illegal and prescription drugs, had a history of driving-related issues. Seems like the kind of driver that shouldn't be behind the wheel. Does Texas have a graduated driver's license?
Yes, sir, they do.
And would that have any effect on picking up somebody's proclivity for driving under the influence or impaired driving?
I think the performance levels, I think, are always useful impaired driving has been a problem in all the states. But I think the graduated driver's license has helped in that regard somewhat. And Texas has some specific rules that if a juvenile is stopped and they have any alcohol whatsoever or any kind of drug, if they're stopped for DUID, their license will be automatically suspended. That's for any alcohol level. One beer, the blood alcohol level doesn't matter if you're under age 21 in Texas. Because of the graduated license law, you're supposed to receive an automatic suspension.
So in this particular case, there was also a fair amount of drug paraphernalia in the cab of the truck. What would be the Texas response to encountering that evidence?
Are you asking me what would have happened if they would have stopped him before the accident? I mean,
Yeah, if they had found the prevalence of the drug paraphernalia in the cab,
yeah.
what would the response of the Texas law enforcement be?
Mr. Rayburn was asking the question as a Texan, but in most states, that would generally result in a citation to the driver. It wouldn't necessarily bring them into a drug diversion program, which is kind of getting to where staff is pointing towards, is that when people are stopped, they need to be able to detect that the driver is actually impaired. Because if we have that detection of impairment and then they subsequently get arrested, they can possibly get into some of the drug treatment and diversion programs that could potentially stop the problem right there. And they could also serve as a general and specific deterrent to them to prevent future drug-impaired driving. So that's what we're primarily going for, is we need to be able to detect these drivers that are impaired.
So thank you for bringing that up. The standardized field sobriety test is a way of determining impairment, and it can also be used in some cases to differentiate between kinds of impairment. Is that an accurate statement?
The standardized field sobriety test is to identify alcohol impairment and not really drug impairment. That's why we were asking for more officers to be trained in advanced drug recognition, because it's important to catch drivers such as this who are at risk of driving while impaired prior to an accident occurring. And that's why we've made a recommendation to the Department of Transportation in Texas.
Okay, I recently read an article, though, that described how using certain of the tests from the field sobriety, standardized field sobriety test, that help to differentiate between types of impairment, types of drug impairment.
Member Weiner, the issue of drug impairment in driving, driving under the influence of alcohol is pretty predictable. But because of the many drug classes involved in drug impairment, there needs to be more training so that officers can recognize impairment and then direct that subject to an expert or the drug recognition expert.
All right, I see I'm out of time. Thank you.
Thank you, Member Weiner. Member Denzar.
Thank you, Chairman. I'll follow up on Member Weiner's line of questioning. I think the reason we're asking this is I actually had the opportunity to observe cadets at a police academy get trained with the SFST. And as I understand it, the series of assessments, it helps officers detect drivers who are impaired by either alcohol or possibly other drugs, and then someone with more advanced training, if needed, if more, I guess, specificity is needed, is brought in. Is that correct?
That's correct. The SFST is designed primarily for alcohol. Some drugs mimic alcohol in their impairment because, after all, alcohol is a drug. It's a CNS depressant. So for signs of impairment outside of that, and that's when we need officers with more advanced training.
So, for example, if an officer saw someone exhibiting signs of impairment, but there was no smell of alcohol, then they might bring in a DRE to determine if there's some other drug involved.
That's precisely what we're saying. The advanced roadside detection program will help the officer realize that there are signs of impairment that they will not see necessarily as with alcohol.
Thank you. So I think that's, we're just trying to clarify the fact that there is, other impairment can also be initially seen through officers trained with an SFST. But now that we're on that subject, Mr. Bragg, thank you. I'll continue on that line of questioning as well. There's a recommendation to promote advanced law enforcement training for detection of impairment. And we all know that police departments and police officers are very stretched for time. They're doing a really important job, and they're working with limited resources, and they should be getting more resources. So could you tell me, this, the A-RIDE program, that's a bridge between and it's a NTSB-created program, is that correct? That's a bridge between the standard field sobriety test, which all cadets get, and then the more advanced DRE training. Is that correct?
Yes. At some point, we recognize that there are many different signs of drug impairment and that the standard SFST program would not catch all of those. So the A-RIDE program was developed to help the roadside officer, the officer who's most likely to come in contact with someone impaired, to realize that this person's on something outside of alcohol. I need someone with more training, and then that's when they would call the DRE.
So could the person with just the SFST, would they call either an A-RIDE or a DRE?
Well, they would most likely call a DRE because a DRE is most prepared to present this case in court, and as you know, can be a very complicated matter.
And I know both we and the Texas Strategic Highway Safety Plan recommends A-RIDE. Could you tell me the benefits of that? I understand that it's a smaller amount of training, but so more officers could have access to it?
Well, you first have to consider that the DRE program is very intensive as far as resources. Requires a large commitment on the officer and the agency. With A-RIDE, it's something that you can virtually train any officer that's on patrol to be on the lookout for drug drivers, and then call in that person who's more prepared to deal with this for court.
Thank you, Mr. Bragg. That's very helpful. And I should say that it's not an insult to my great state at all, Vice Chairman. In fact, it's a compliment that we're very ambitious in our plan. But I absolutely agree with Member Homendy that we should be seeking to go towards zero. But I think the problem here is not just the numbers. I think it's that we don't have the action being taken at the top levels of leadership in Texas. I think there are advocates and road safety professionals and planners, all of whom I actually saw working on the Strategic Highway Safety Plan in Texas. But I think that that's part of the reason that staff is proposing this recommendation, is that we need the executive level so that it's not a question of funding, it's a question of prioritizing the funding for this important these safety measures. So thank you.
Member Denzar, thank you very much, and Member Hamidou.
Thank you. And I think it goes beyond just the top level in Texas. When it comes to the Texas Strategic Highway Safety Plan, if you look at the executive committee signatures to the plan, it includes 2 representatives from the Federal Highway Administration and 1 from NTSB. So clearly they were part of it, and NTSB has to approve it in order for the state to get some funding. So I think maybe they need to take a closer look at that. Dr. Kaminsky, we have, or Mr. Kaminsky, sorry, I gave you a promotion. We have safety recommendations going back to 1986 on the poor performance of lap belts and how lap shoulder belts would provide greater survivability in a crash. Why was this vehicle only required to have occupant protection for the driver?
Well, because as I said before with the H10-3, we're wanting all vehicles to have the proper occupant protection. So we're trying to fill this gap between 10,000 and 26,001 pounds, where everybody should have accessibility to having a lap and shoulder belt to give them the best protection.
So in other words, in the rulemaking, they were excluded.
That's correct. In
Okay.
the rulemaking that came out in 2016, they only included large buses and motor coaches over 26,001 pounds to have lap and shoulder belts at every seating position. But that leaves a big gap between 10,000 and 26,000 pounds.
Do you have on with you NHTSA's response to the recommendation that they sent us in April of 2016?
Yes, in fact, I can read that. Because of the development of regulations of these buses, did not expand applicability of these rulemaking actions to buses with 10,000, 26,000 pounds, because the development of a regulation for these buses was not found to be cost beneficial.
So cost was the issue, and I would suggest that, I mean, this is the reason why you do your work. You know, they look at the cost. Unfortunately, they determined it wasn't cost effective, and maybe they need to look at a little bit more broadly, but that's why what you do is so important, so thank you. I want to circle back on the funds the states use to address drug driving. Can states use their state and community highway safety grant program funds or national priority safety program funds to address drug driving?
Yes, they can, and like I said before, they have been using it recently. However, there are specific guidelines that states have to comply to. NHTSA provides a uniform set of guidelines. In this case, it's Uniform Guidelines 8 for alcohol and drug-impaired driving. And so when they're submitting their plans of what they're going to spend their money on, they have to stay within the lines. They can't just basically spend it on anything. They have to spend it on items that NHTSA has approved.
Okay. And how does state spending on drug driving compare to alcohol-impaired driving? Their efforts.
Well, in the state of Texas and in most states, it's basically alcohol and other drug countermeasures. And it's hard to weed out how much is spent. At the same time, I wouldn't necessarily say that you want to take money away from the huge alcohol problem and devote it to drugs either. You know, a lot of the strategies to address alcohol-impaired driving also applies to drug-impaired driving, many of the strategies. And, you know, so basically the bottom line is the funds are commingled.
Okay, great, thank you.
Thank you, Member Hamady. So for those who are watching in the public, Mr. Bragg, we've mentioned terms like DRE and ARIDE. So let's just kind of briefly walk through what each of those are and what they mean, and the training that would be required for each. Just give us a thumbnail sketch of that, please.
Okay, the most basic level will be the SFST, or Standardized Field Sobriety Test. Practically every officer gets this training during their basic training, which lasts about 40 hours. The next level will be the Advanced Roadside Impaired Driving Enforcement, or ARIDE. This is a 16-hour program given about 2 days, and it's normally given to an officer after they've had some patrol experience, and they're pretty well versed in standardized field sobriety tests or making impaired driving arrests. And the highest level would be the DRE, the drug recognition expert. This training is given in 3 phases. The first phase is 16 hours, and that's where they give a kind of an introductory to the course. Then there's a 72-hour training, which goes into in detail on making arrests. The last phase is they do field examinations, where they have to do 12 DRE examinations on live subjects. And then at the conclusion of this, they have a overall exam they have to pass. It's a very rigorous course. An officer has to be really dedicated to get through the program.
Okay, thanks. And so how does the state of Texas compare with the percentage of specialists in these areas compared to the national average?
As I mentioned in my presentation, the national average is about, I think, 1.6%. But for Texas, it's only about half of that.
So I don't take objection to the state of Texas either. I've got a state flag, Texas state flag flown over the Capitol in my office, given to me by a member of the House of Representatives or the Texas legislature. So, but that is that's interesting there that they've got about half the percentage that the national average is, and so. And you say they're number 5. Did I hear they're number 5 in the nation for alcohol-impaired deaths? Is that correct?
They're number 5 for the year that we looked at, but they've been in the top 10 over the last decade in the rate of impaired driving fatalities per vehicle miles traveled.
And that, of course, would be the most accurate measure because it would be the rate. And so they're in the top 10 over the years, over the last several years, for a high rate compared to the others.
And another area of concern in the same area is when you look at those fatally injured drivers that are basically getting a test done. In Texas, it's 38% are above a 0.08, 44% are above a 0.0 blood alcohol content. That compares to a national average of 28%. So there is definitely something going on with an impaired driving problem that needs to be addressed.
Thank you very much. I do want to, I see on page 47 of the draft report, it talks about that most law enforcement officers are trained insufficiently to detect drug-impaired driving, and that several organizations such as the GAO, Governor's Highway Safety Association, and the International Association of Chiefs of Police have commented that there needs to be better training for drug-impaired driving. Would anyone like to comment on that?
That was a study done by the Government Accountability Office where they actually spoke to prosecutors, highway safety officials, NTSB representatives, a large number of groups, and they found that that deficiency existed as to the number of, because it's so much more difficult to detect somebody that's under the influence of drugs, there needs to be additional training in that area. When we're talking statistics earlier, my home state is California, so I always like to make the comparison to California. And what was interesting in this, like in 2016, Texas held 21 A-ride classes, training about 400 and some officers. California, on the other hand, had over 100 classes training about 4 or 5 times that amount. And so it's just a matter of, what the priority is and, how you want to, address the issue. Now, California obviously is struggling with the recent legalization of marijuana, so pretty much every state trooper in the state of California has had at least the 16-hour A-ride training so that they can detect the marijuana in drivers that are stopped.
Good, thank you. Tell you what, why don't we take a break, and then we'll come back for the third round. And according to that clock there, let's come back at 11:25, and we are in recess. 11:25.
It was.
We'll begin very shortly. Okay, we're back in session. We'll begin with another round of questions. Member Weiner, we'll begin with you, sir.
The draft report discusses roadside drug testing. Does Texas constitutional, statutory, and case law allow for saliva testing to be used and then admitted in court?
At this time, sir, it does not.
So is that a major impediment then to using saliva testing?
Well, right now, saliva testing is a relatively new technology, and there's only been about 15 states right now that have permitted the use of oral fluid testing, and there's 10 states that are actually piloting right now. The issue really is, I think states would adopt it a lot faster if NTSA provided guidance to the states on oral fluid testing.
So there's no federal guidance at this point?
At this point, NTSA has actually done studies on oral fluid testing, but they have not published a report on it. So at this time, there is no guidance from NTSA.
How effective is the oral fluids testing?
There are several oral fluid testing devices. There are differences between them, but the two that are used the most right now, which is the Alera DDS2 and the Draeger Drug Test 5000, they have both been proven to be very accurate when it comes to identifying certain classes of drugs.
So are we making any recommendations then along the line of fluids testing?
Yes, we are making a recommendation. I think it's important to, the recommendation is for NTSA to provide guidance to states on oral fluid testing. As I mentioned before, oral fluid devices are very different. Not all of them are very accurate. Not all of them measure the same drugs, and not all of them have the same cutoff points. So there are differences in this, and in order to have valid data, all of these things need to be standardized, and that's why we've actually made a recommendation to NTSA to help the states do so.
At the recent Lifesavers annual conference, I noticed quite a number of booths put on by oral fluids testing folks. So it apparently is a subject of a great deal of effort at this point. Let me just change to the advanced training, the SFST, the ARIDE program, the DRE program. As was mentioned by Mr. Bragg, there's a fair amount of time required to take this advanced training. Is that a real impediment, and is it more of an impediment for a small town, small city, where they've got a limited number of officers?
Yes, the training is an impediment, just by the amount of time that's committed to do it. Not just the initial training, but there's also a recurrent training which must take place. So it does require a great commitment for resources.
Is there any federal grants that can be used by these localities to defray some of the costs of this training?
The federal alcohol and drug countermeasure grant money is used to fund DRE classes, and it was being used in the state of Texas for that. I think, like Mr. Bragg was saying, the biggest issue with DRE training is it can take 60 to 70 hours of training plus the recurrent training. That's why the A-Ride training, which is the gap, the 16-hour course, may be more feasible for a lot of agencies to at least get a basic level of drug-impaired driving enforcement training.
Thank you, Mr. Carroll. Thank you, Mr. Bragg.
Thank you, Member Weiner. Member Denzar.
Thank you, Chairman. I'm thinking about law enforcement and small towns in Texas, and I think it's difficult for there just to be even enough officers around to even make stops. And we know there's proven studies to show that the more stops, I mean, there's a lot of good results in criminal, other areas. So that's a whole nother issue of having more police officers on the road. But assuming they are, when they make a stop, how do law enforcement officers handle an impaired driving stop? And I suppose my real question is, what's the likelihood of testing for marijuana once there's another substance like alcohol detected? I'm assuming it's very low.
Well, each state has a statewide DRE coordinator. So even if an agency doesn't have a DRE officer, there's normally a state officer or nearby jurisdiction that will have a DRE available. Once a subject has been stopped and he's been identified to be under the influence of a drug while driving, that officer will contact the DRE officer, and the subject will be taken to the evaluator, and the evaluation takes place.
And sorry, Ms. Bragg, I was actually asking the opposite side. If they've already been stopped, you know they are under the impairment of alcohol. There is some association between having multiple drug impairment, but it's unlikely they're going to also be tested for something else after they've been found to be impaired with alcohol. Is that right?
You're correct, Member Denzar. The statutes in Texas right now they don't distinguish between impairment by alcohol and by drugs, so that if somebody's found to be impaired by alcohol, it's less likely that they would be tested for drugs as well.
And I mean, I understand, I sympathize with these police officers. I mean, they only have a certain amount of time, and they've found one violation. But that certainly affects our data and our ability to know the prevalence. So just to point that out, I think people don't realize that sometimes it's just not, police officers, as much as they would like to, they're not able to, or in many cases, there just aren't enough police officers to go around.
This is true, but one thing that we mentioned in the report is that this driver had actually been stopped over the years about eight or more times. So we make the point that had this driver been stopped by somebody with A-Ride training, it's more likely that this driver and maybe other drivers that are at risk of impairment would be identified and taken off the roadway.
That's a good point also, Dr. Marshall. And Mr. Carroll, I'm glad you brought up alcohol-impaired driving. Even though this was not an alcohol-impaired driving crash, we still know that 10,000 people die every year in those type of crashes. And even though I joke with the Vice Chairman about how great the state of Texas is, we have a long way to go. I think 1/10 of all the nation's deaths related to alcohol are in my own state. So that means that, we have a lot of work to do. But thank you very much, and those are all my questions.
Thank you, Member Member Denzar and Member Hamady.
Thank you. Dr. Marshall, you said something interesting earlier, which was that law enforcement officers, when they're at the academy, that they're provided standardized field sobriety test training there. Do you think they should be maybe provided A-Ride training as well? Maybe that might be for Mr. Bragg. I don't know which one, but and the reason I'm asking this is I think training is crucial. I have hazmat operations level training, and most firefighters are trained at the general awareness level. There's also incident commander and technician level, but I think the more advanced training in hazmat operations, it took me 3 or 4 days to get that. But there might be other opportunities to provide law enforcement with training, and that could be at the academy, which is why I'm asking.
One of the benefits of ARAT training is it also gives the experienced officer an opportunity to refresh the training. And additionally, the experienced officer is more likely to benefit from ARAT training because he understands some of these things after being on the road. So it's most well suited for the experienced officer.
Mm-hmm. And do you have suggestions on ways for states to increase training, given some constraints for some of the smaller?
I think it goes to the recommendation that we're proposing is that, first of all, the training needs to be promoted in the state of Texas. The International Association of Chiefs of Police and NTSA is promoting it fairly well on a national level. So it needs to be promoted in the state, and there also has to be access. Access means not only enough classes, but it also has to be that it's geographically available to people across the state. So instead of having to travel up to Sam Houston State University up near Houston, you know, that it's available in classes. And Texas is providing classes, but they need to basically expand their access and promote it.
Okay, great. And I have possibly two more questions. The next one, when the NTSB investigates a crash, we form parties to an investigation, and many times federal agencies are invited to be parties of those investigations, FRA, FAA, FMCSA, and sometimes NTSA. And in this case, NTSA was notified of the crash and for some reason decided not to investigate it. But in some situations, the NTSB and NTSA have jointly investigated a crash, but in many times we offer NTSA party status. Can you talk about why we do that, what the benefits are for the NTSB, and what the benefits are for NTSA, it would be NTSA in this case, and the overall investigation?
Sure, thank you for the question. As you know, the NTSB is a small agency. We have about 400 people overall, and that's including investigators in all modes of transportation, as well as our support staff. So as you mentioned, we have a system called the party system, where when an accident occurs, we invite those with technical expertise that are involved in the crash, such as the regulator or the manufacturer and many others, to participate with the NTSB during the investigation. So there's a lot of benefits for that. There's benefits for the NTSB, obviously, because we get to leverage the expertise of those technical experts. Those technical experts also get the benefit of participating in the fact-finding gathering of this investigation from day one. So they help us to ensure that we have a complete and accurate factual record of that investigation, which is critical from both sides. In addition, because they have this access to the factual information from the very beginning, it allows them to initiate preventative or corrective actions very early on in an investigation. So this can be very beneficial for manufacturers, but obviously for NTSA, as we've talked about in some of the previous crashes, having that access to that factual information to show the extent of the injuries in this case or in other cases, other information can be extremely beneficial when they're looking at changes to regulations.
Great, thank you very much.
Member Hamady, thank you. And I want to make a point here. Member Denzar said sometimes there's not enough police officers to go around, but we're talking about a rate of the police force. Is that not correct? That 0.65% of law enforcement officers in the state of Texas have undergone DRE training, whereas on the national average is 0.12. So we're talking about a rate. So the idea of not enough police officers to go around, that's a separate issue. Okay, all right. And we're not trying to cast blame or point fingers. What we're trying to do, as Member Denzar did say, is we're trying to point out an issue that we've identified, that there needs to be greater law enforcement of people, of law enforcement officers that are out there trained and conducting roadside testing when somebody is pulled over for impairment, whether it's alcohol impairment or drug impairment. Is that basically correct?
Yes, but we can't, this is a problem that we're not going to be able to arrest our way out of. It's part of the thing, but we also need all those other pieces, such additional engagement by the legislators as far as laws and, all the other pieces of the puzzle.
Thank you. Let me follow up on one thing here. I noticed in the report that the driver of the truck reported to a witness soon after the crash, or told somebody after the crash, that there was excess play in the steering wheel. Did the investigation find any problems of any steering wheel problems, steering issues?
Sir, we actually removed the steering gearbox from the vehicle, brought it back to our RE, and we examined the external and internal components of the steering gearbox and found no excessive wear or anything that would substantiate that statement from the driver. And also at the scene, we also examined the undercarriage of the vehicle and all suspensions related to that steering column and found no unusual wear either.
So the physical evidence did not corroborate the driver's
That's
statement.
correct, sir.
Okay, thank you. I want to talk about lap shoulder belts, and I thought the discussion in the report was very interesting there, that just a lap belt alone causes, can be there are not nearly as many safety benefits associated with just the lap belt as opposed to the lap shoulder belt, and the flailing and all of that goes on can be devastating. So why did NHTSA not require lap shoulder belts in their 2016 rulemaking for vehicles over 10,000 pounds?
Well, as I said, in 2016, they came out and said that it didn't seem to be cost beneficial.
Okay, and I'm curious about that. How much, if vehicles of this size, if each seating position was required to have a lap shoulder belt, any idea what incremental cost that may incur per vehicle?
Yes, sir. To upgrade to a lap and shoulder belt would be anywhere between, depending on if you're getting leather or whatever, between $113 and $150 per seat. In this case, we have a 15-passenger seat, about $3,000, maybe, it'll be about 3% of the vehicle like this would be $50,000. So adding that lap and shoulder belts would be about 3% more.
Okay, that's interesting. So we're not just talking about the belt, I guess, and the attachments. Is it true that the floor might have to be beefed up or something, or the structure of the vehicle?
In this vehicle, even though it was a 2004, the floor was already outfitted to be, if they wanted to put lap and shoulder belts, it was all set to go. That's why there was no deformation. The seats remained in place that weren't involved in the intrusion area, and everything, all the seats, everything remained intact. And
Great, thank you. I have no further questions, and I believe the Vice Chairman had a follow-up question.
when we say occupant protection, that includes lap and shoulder belts.
And just to further clarify, when NHTSA was making their rulemakings, they were focusing on motor coaches. And so that H10.3 was a recommendation coming out knowing that NHTSA was focusing on rulemaking for motor coaches. And so during that rulemaking, they were looking at a variety of ways to improve occupant protection. There was also talk about strengthening the roof in order to provide survivable space in rollover crashes, and then having advanced window systems so that those window systems would stay in place and protect the passengers if the vehicle rolled over on its side or onto its roof. So when we were making H10.3, we were focusing on the work that NHTSA was doing. So include in your rulemaking for motor coaches occupant protection systems, advanced glazing, the roof strength systems. NHTSA ultimately, as Mr. Kaminsky pointed out, passed rulemaking in 2016 for motor coaches and other large buses over 26,000 pounds requiring lap shoulder belts at all passenger seating positions. We knew that was the work that they were going forward with, and that was the research that they were looking at. What we were asking was that they include all buses 10,000 pounds and above in that rulemaking, anticipating that that would be lap shoulder belts to address occupant protection.
Thank you. Any other follow-up questions? Okay, seeing none, Mr. Jones, if you'd kindly read the proposed findings.
Thank you, Mr. Chairman. As a result of this investigation, staff proposes 13 findings. 1, none of the following were factors in the crash. 1, bus or truck driver qualifications or familiarity with vehicles and roadway. 2, medical condition or fatigue of the bus driver. 3, bus driver's cell phone distraction. 4, bus driver impairment by alcohol or other drugs. 5, mechanical condition of either vehicle. 6, highway condition, or 7, weather. Finding 2, considering the rural location of the crash, the emergency response efforts were timely and adequate. 3, the truck driver operated his vehicle erratically on US Highway 83 for more than 15 minutes, including extended periods of travel off the right road edge line and multiple incursions across the highway center line, which culminated in a head-on crash in the opposing lane of travel. 4, it is possible that the truck driver was glancing at or manipulating his cell phone at the time of the crash, but this action would not explain the prolonged and continuous erratic driving behavior seen in the witness video recording leading up to the crash. 5, the truck driver was not sleep-deprived, impaired by a medical condition, or impaired by alcohol at the time of the crash. 5, the failure of the truck driver to maintain control of his vehicle was due to impairment stemming from his use of marijuana in combination with the misuse of a prescribed medication, clonazepam. 7, to better detect drivers operating under the influence of drugs, law enforcement officers need advanced training to identify the signs and symptoms of impairment, as well as additional tools such as roadside drug screening devices. 8, oral fluid drug screening devices can improve the ability of law enforcement officers to detect drug-impaired drivers. 9, the state of Texas needs increased safety-focused leadership at the governor and state legislature level, additional resources, and data-driven strategies to prevent tragedies such as the Concan crash, and to reduce the number of fatalities and serious injuries caused by alcohol and other drug-impaired drivers. 10, because the use of legal and illicit drugs by drivers is increasing, national leadership is needed to help prevent drug-impaired driving crashes by identifying best practices, effective science-based safety countermeasures, and drug testing protocols. 11, the lap belts provided insufficient protection for the passengers seated in the rear of the bus. 12, the narrow anchorage points for the lap belts contributed to the severity of injuries to passengers seated in row 4 of the bus. Lastly, 13, because lap shoulder belts provide a greater level of occupant protection than lap belts, they should be installed as standard equipment on medium-sized buses.
Well, thank you, Mr. Jones. Are there any proposed amendments? Seeing none, do I have a motion to adopt the findings as proposed? It's been moved by Member Weiner, seconded by the Vice Chairman. Any discussion? Seeing none, no discussion. All in favor of adopting the proposed findings, signal with a hand and say aye. Opposed? There are none. The motion passes unanimously. Now, Mr. Jones, if you'll kindly read the proposed probable cause.
As a result of this investigation, staff proposes the following probable cause. The National Transportation Safety Board determines that the probable cause of the Concan, Texas crash was the failure of the pickup truck driver to control his vehicle due to impairment stemming from his use of marijuana in combination with misuse of a prescribed medication, clonazepam. Contributing to the severity of the injuries was the insufficient occupant protection provided by the lap belts worn by passengers seated in the rear of the medium-sized bus.
Thank you, Mr. Jones. Are there any proposed amendments to the probable cause? Seeing none, is there a motion?
So moved.
It's been moved to adopt the probable cause as proposed. It's been moved by Member Denzar, seconded by Member Hamady. Is there any discussion? Seeing none, all in favor of adopting the probable cause as proposed, please signal with a hand and say aye. Opposed? There are none. The motion passes. The probable cause passes unanimously. Mr. Jones, please read the proposed recommendations.
As a result of the investigation, staff proposes 7 new safety recommendations. 3 recommendations to the National Highway Traffic Safety Administration. Recommendation 1, develop and disseminate best practices, identify model specifications, and create a conforming products list for oral fluid drug screening devices. 2, evaluate the best practices and countermeasures found to be the most effective in reducing fatalities, injuries, and crashes involving drug-impaired drivers, and provide additional guidance to the states on drug-impaired driving and countermeasures that work, a highway safety countermeasure guide for highway safety officers. Recommendation 3, amend Federal Motor Vehicles Safety Standards 210 to increase the minimum anchor spacing for individual seatbelt assemblies, taking into account the dynamic testing of seatbelt designs, seatbelt fit, and vehicle configuration. 1 recommendation to the state of Texas. Recommendation 4, conduct an executive level review of your impaired driving program and implement data-driven strategies that result in a downward trend in the number of fatalities, injuries, and crashes involving alcohol and other drug-impaired drivers. 1 recommendation to the Texas Department of Transportation. Recommendation 5, promote the importance of attending drug-impaired driving enforcement training and increase training access to meet the demands of local and state law enforcement. 1 recommendation to medium-sized bus manufacturers, Arbuck Specialty Vehicles, LLC, Coach and Equipment Manufacturing Corporation, Rev Group, Inc., Diamond Coach Corporation, Forest Rivers, Inc., Gerardin Bluebird, SVO Group, Inc., and Thomas Built Buses. That would be recommendation 6, install lap shoulder belts in all seating positions as standard rather than optional equipment in all newly manufactured medium-sized buses. 1 recommendation to seat manufacturers, Friedman Seating Company and HSM Transportation Solutions. Recommendation 7, supply seating systems equipped with lap shoulder belts as standards rather than optional equipment for medium-sized buses. Staff proposes the reiteration of 2 previously issued recommendations. To the National Highway Traffic Safety Administration, Recommendation H1233, develop and disseminate to appropriate state officials a common standard of practice for drug toxicology testing, including 1, the circumstances under which tests should be conducted, 2, a minimum set of drugs for which to test, and 3, cutoff values for reporting the results. Recommendation H103, in your rulemaking to improve motor coach roof strength, occupant protection, and window glazing standards include all buses with a gross vehicle weight rating above 10,000 pounds other than school buses.
Okay, thank you. Are there any proposed amendments? I actually have a question. And it, it's not, didn't come from me. The vice chairman was asking me about it, and so I want to probe around this. On H10-3, we say, in your rulemaking to NHTSA, in your rulemaking to improve motor coach roof strength, occupant protection, and window glazing, include all buses with a gross vehicle weight rating above 10,000 pounds, other than school buses. So my question is that rulemaking is completed? What rulemaking were we referring to? The one that came out in 2016?
So the rulemaking for lap shoulder belts on motor coaches was completed in 2016. NHTSA has not completed the rulemaking for the roof strength or for the glazing. So that is still an open opportunity. So there's an opportunity for them to address these buses altogether for all three aspects when they're completing that rulemaking. But as for the motor coaches and the other large buses, that was completed in 2016.
Yeah, what I thought I heard you say was that they've already completed the occupant protection aspects of that.
So the portion of the occupant protection that was the lap shoulder belts, they completed that in 2016. For us, all of these aspects, to some extent, deal with occupant protection. The roof strength is ensuring that there's survival space, and then the window glazing is keeping occupants inside the vehicle. So obviously, even if you're belted, if you lose a window during a rollover crash, you can still have injury. Those rulemakings are not complete at this point.
Let's take the window glazing and the roof strength off the table, because that's not really the issue here. The issue here in this crash, the Concan, Texas crash, is the lack of lap shoulder belts, is it not?
Correct. In this crash, we were looking at the lap shoulder belts.
So since NHTSA has already completed the rulemaking portion dealing with lap shoulder belts, it would seem to me that we need a new recommendation, since they've already completed that portion of 10-3, H10-3. Too many green lights.
It's contagious.
Well, yeah, I don't know what the deal is here. Okay, Dennis is
Yeah,
working.
mine's working.
Okay.
Mine's working.
Well, okay.
So this is a good area for discussion. Staff spent a lot of time talking about this as well, in terms of whether it's more appropriate to issue a new recommendation to NHTSA, and then how to address these, because there were really three components with the H10-3, as you've pointed out. There's the occupant protection, which essentially is the lap shoulder belts, the window glazing, and the roof strength. That recommendation is still open because 2 out of the 3 have not been completed. So we did spend a lot of time trying to determine whether there should be a new recommendation to NHTSA, or whether this recommendation was still relevant to them because they didn't complete the actions concerning the medium-sized buses, and then they didn't do the 2 other aspects. So staff felt as though NHTSA still had the opportunity to be able to revise FMVSS 208 to include buses 10,000 pounds and above to address lap shoulder belts, and obviously address the other aspects when they're looking at that rulemaking for motor coaches and other large buses.
Since a contributing factor to the severity of the injuries, as the board just unanimously adopted in the probable cause, says the insufficient occupant protection provided by lap belts worn by passengers seated in the rear of the medium-sized bus. I mean, that's really a salient issue in this crash. And I didn't think of this. The vice chairman's the one that brought it to my attention, and the answers I was hearing just confused me even more. So I am going to make a motion that staff, and here's my motion, staff draft a recommendation and circulate it to the board through the notation process to be included in this package. We're not going to draft a recommendation here at the dais. That usually doesn't work out. Staff draft a recommendation and circulate it for board member approval, a recommendation that would specifically address lap shoulder belts in vehicles weighing 10,000 pounds or more. And that is my motion. Is there a second?
Second.
It's been moved and seconded. Any discussion? No discussion? All in favor of that motion, please signal with a hand and say aye. Did not see the vote. I usually look at the screen but did we have, let's do it one more time. All in favor, signal with a hand and say aye. Aye. Okay, there's 5. All opposed, signal and say nay. There's none. The motion passes unanimously. And so staff will circulate for the board's approval to be included in this report. Now, that's an amendment. Do we have a motion to adopt the recommendations as amended? It's been moved by Member Weiner, seconded by the Vice Chairman. Any discussion?
Mr. Chairman, just as a point of clarification, are we also still leaving in the reiteration of 10-3?
Yeah, and I appreciate that clarification, and yes, I appreciate it. My intention was, subject to the board's agreeing that this is what we voted for, my interpretation is that we could continue, that I intended for H10-3 to continue to be reiterated, if that's what staff wants, but I felt that we needed a standalone recommendation specifically addressing the lap shoulder belts. And thank you for the clarification, Ms. Silbaugh. If you think we could delete, but that's going to require some page changes. Would staff like to take a 7-minute recess to consider how you'd like to handle that?
Yes, please.
Okay, please do. And
Thank
we
you.
will be in recess until 12:10. Thank you. We'll get started here momentarily. Okay. We are back in session, and Dr. Poland, what would be the recommendation of staff?
Staff would prefer to remove the reiterated recommendation H10.3 from the report and circulate a new recommendation to NHTSA that's focusing on the need for lap shoulder belts in these buses 10,000 pounds and above.
Okay, great. Good. I'm going to make a motion. I'm going to preface my motion with the fact that we have already made the motion as adopted by the board to insert the recommendation dealing with the lap shoulder belts. So that one's already been in there. So my motion now is to take H10-3 and strike that as a reiterated recommendation from the report. Is there a second?
So moved.
It's been moved, seconded by the vice chairman, and any discussion on that? That would meet the desire of what you're discussing. Is that correct, Dr. Poland?
Yes, thank you, Chairman.
Yes, thank you. And Ms. Silbaugh, thank you for the clarification of that, and thank you. So it's been moved and seconded to strike H10-3 as a reiterated recommendation from the report. Is there further discussion? Seeing none, all in favor, signal with a hand and say aye.
Aye.
Opposed, there are none. That motion passes unanimously. Now we have to go and clean up, and is there a recommendation to adopt the recommendations, excuse me, is there a motion to adopt the recommendations as amended? It's been moved by Member Weiner.
Second.
Seconded by Member Denzar. Any discussion? There's none. All in favor of adopting the recommendations as amended, please signal with a hand and say aye.
Aye.
Opposed? There are none. The recommendations have been adopted as amended. So does anyone have any additional issues for discussion as it relates to this report? Do we have a motion to adopt the report as revised? We'll adopt it as revised now, subject to staff circulating the page changes for the recommendation we adopted a minute ago.
So moved.
Okay, it's been moved to adopt the report as revised. It's been seconded by Member Hamady. Is there any further discussion? All in favor, signal with a hand and say aye.
Aye.
The motion to adopt the report as revised has been adopted. Do any members wish the right to file a concurring or dissenting statement? Member Denzar, Member Weiner have reserved that right. So in closing, I want to thank the staff for your hard work. I want to thank my colleagues for the preparation going into the meeting, studying, writing memos, meeting with staff individually. I thank you for that, and for the good discussion in the debate this morning. My special thanks to Dave Rayburn, who served as the IIC, the investigator in charge, but also Jennifer Morrison, who's hiding in the audience, who also was the investigator in charge until she took a detail in another area of the agency. Thank you both for heading up this investigation, but as I've said, nothing ever happens individually. It's an entire team, many of whom you are seeing right here today, but it's also a team. Nothing gets done without our support staff, even somebody, James Anderson or Deidre, who comes down to give us the microphones when they don't work. Everything we do here is a team effort. And so thank you for the entire NTSB team. The recommendations just issued and reiterated, if acted upon, will result in better federal level guidance for best practices and countermeasures. They will also result in state programs in Texas that take a data-driven approach to reducing the disproportionately high impact on impairment on Texas road users. And it will increase training access for frontline law enforcement officers in Texas. And finally, these recommendations will result in passenger lap shoulder belts as standard equipment in newly manufactured medium-sized buses. Relatively speaking, states are just now beginning to sink their teeth into drug driving countermeasures. I know it won't be easy to get to zero impaired driving deaths, but at least we can agree to make the goal a decrease in fatalities, not an increase. We stand adjourned.